Fagolitos Plus is a food supplement that helps to dissolve and reduce the risk of calcium oxalate and/or calcium phosphate crystals. It contains hydroxycitric acid, magnesium, vitamin B6, zinc, and vitamin A in their optimal doses. Hydroxycitric acid is the active substance of Garcinia Cambogia. It causes electrostatic interactions with calcium ions, forming hydrogen bonds with calcium oxalate and phosphate crystals, inhibiting the nucleation and growth of these crystals. It is adsorbed on the surface of the crystals, causing a strong tension that leads to the dissolution of the stones. It is active in supersaturated solutions and at acidic pH. Hydroxycitric acid is significantly eliminated in urine after oral ingestion. As a problem presents its short half-life. A part of hydroxycitric acid contains magnesium, that reduces the absorption of dietary oxalate, vitamin B6, it reduces endogenous oxalate production, zinc, it is antibacterial and contributes to the normal function of the immune system, vitamin A, contributes to the normal maintenance of mucous membranes. What does Fagolitos Plus do? Reduces the production of endogenous oxalate. It reduces the absorption of dietary oxalate and inhibits the formation of calcium oxalate and calcium phosphate crystals. It inhibits the growth of stones and promotes their dissolution, even in conditions of supersaturation and acidic pH. In an in vitro study conducted in our facilities with calcium oxalate stones, we observed Day 1. Crack formation. Day 11. The mass loss of the renal calculus is greater than 15%. Day 29. The mass loss is greater than 55%. Day 40. The mass loss is 78%. Without a doubt, promising results. Fagolitos Plus is a continuous release granulate, keeping all its components in urine for 24 hours. Posology. In patients with previous episodes of calcium oxalate and/or calcium phosphate lithiasis without current stones, 1 sachet per day. In patients with calcium oxalate and/or calcium phosphate stones currently present, 2 sachets a day, 1 in the morning and 1 at night. Pour the contents of a sachet directly into the mouth, in one or several portions, and swallow the granulate with the help of a little water. It can also be dispersed in a yogurt or jelly. Take preferably with food intake. It has a pleasant mint flavor with aromas of anise, mint, and eucalyptus. Important: do not dissolve. Do not chew. Fagolitos Plus acts in 95% of patients with renal lithiasis. It is advised in patients with calcium oxalate and/or calcium phosphate lithiasis, patients with calcium lithiasis who have hyperoxaluria and/or hypomagnesuria, patients with presumably calcium lithiasis when a study of the composition analysis of the stone is not available. Suitable for diabetics, celiacs, and lactose intolerant, without undesirable effects or interaction with other products. There are no products on the market that contain optimal slow-release hydroxycitric acid in renal lithiasis. Comfortable dosage. It is rapidly absorbed, not metabolized, and rapidly eliminated in urine. Single continuous release hydroxycitric acid. Its use does not alkalize the urine, so it does not contribute to the formation of calcium phosphate crystals. Effective in reducing and dissolving crystals of calcium oxalate and/or calcium phosphate even under supersaturated conditions and at acidic pH. Fagolitos Plus, the natural control of kidney stones.